And I'm very excited to introduce our first speaker, who is Dr. Carman Turkelson. She is an associate professor and the director for the Center for Simulation and Clinical Innovation in the School of Nursing at the University of Michigan, Flint. She's been a nurse for almost 30 years and has extensive experience in critical care, management, and education. Her interest in the use of simulation began in 2008, and since that time, she has continued to cultivate her expertise in this field. She is currently also serving on the board of directors for Anaxel and is involved in the Society of Simulation in Healthcare. So two societies for a lot of those links that we shared yesterday. So we are very happy to have Dr. Turkelson with us today.
Good morning, everyone. Hopefully everybody can see my screen and hear me. I am Dr. Carman Turkelson, and I'm super excited to be here today with you. And I have to apologize up front. I'm recovering from COVID last week, super sick, and so lost my voice. So if I'm coughing or clearing my throat a little bit today, that is why. But again, I'm super excited to be here today to talk to you about simulation design and what I call kind of unlocking that mystery. So a little bit about myself. I have been involved in simulation since 2008. And just to kind of tell you about my journey in simulation, I was actually sent to a conference at the time by my boss, and I was working in the acute care setting or in the hospital. And she sent myself and another coworker to a conference that Dr. Pam Jeffries was speaking at. And at the time, neither Mary or myself knew why our boss had sent us to that conference. As soon as we got back from the conference, we were then promptly told that we would be implementing simulation into our critical care residency program and med-surg residency program. So I was kind of tossed into it head first, so to speak, back in 2008, and again in the hospital side of things. And so I quickly decided that I really didn't know what I was doing and needed to learn a lot. So I've spent the last more than decade now really immersing myself in simulation, and I've taken part in multiple simulation fellowships, including a fellowship through the National League for Nursing, 2 fellowships through Anaxel, one the Anaxel CAE fellowship, and then also the Anaxel Research Fellowship, really trying to immerse myself in this field of simulation. And in these fellowships, I had the opportunity to be mentored by experts in simulation, including Dr. Jeffries, Dr. Cardon Agren, Dr. Teresa Gore, and multiple others. And then also in my doctorate program, which I have a DNP through the University of Michigan, Ann Arbor, I had the privilege of being mentored by Dr. Abersol, who I know will be involved in this conference that you're participating in too. So really surrounded myself by experts over the years, learned a lot. I've conducted simulations both in the hospital setting and now in the academic realm. So I'm hopeful that I can share some tips with you guys about designing and developing simulations that I've learned along the way. I wasn't sure if this was required or not, but I don't have anything to disclose. Basically, what that means is nobody's paying me to be here today. Nobody's paying me to say anything on behalf of their company or equipment. I wish there was something different I could say here, that I was, making lots of money off of this, but honestly, it's something I'm passionate about and enjoy doing, but I have nothing to disclose. Here are some objectives that I wanted to cover today with you all. I wanted to talk about some different strategies, at least 2 strategies that are based on the healthcare simulation standards of best practice. I know you learned about these yesterday. If you hadn't already known about them, they were just revised last fall. And so I will be referencing the healthcare simulation standard of best practice simulation design throughout my presentation this morning. We'll also discuss 2 critical elements based on those standards. And then we'll describe how they can support, using these standards can support simulation design so that you're developing educationally sound simulation-based experiences that are based on the evidence that we know. So how do you get started? So this may be something that's a little bit intimidating for you if you haven't designed a simulation before. And I do want to tell you, full disclosure, if you're brand new at designing simulations, you don't actually have to design your own simulation. There are numerous simulation scenarios that are out there that you could utilize right today. You could go, for example, to the National League for Nursing website, and they have simulation scenarios called ACEs, or unfolding cases. These scenarios have already been fully developed by content experts and simulation experts, and they have been vetted across multiple universities, meaning they have been piloted, feedback's been given, revisions have been made. And so what you see on the National League for Nursing website are fully developed, tested, tried and true simulation scenarios that you could actually take and implement into your program today without having to do really much at all. And they are developed in the standard, following the standards of best practice. So if you're, like I said, brand new, that's probably the best place to start. Of course, today I'm going to talk you through how I've developed different simulation scenarios, because sometimes those scenarios that we have from like the National League for Nursing or other websites don't exactly fit what we need to do with our learners. And so that may be where you need to get started on designing and develop your own simulation. Like I said, it can be intimidating at the beginning, but in the end, like the slide says, the only thing you're going to regret is if you didn't take the chance. And I think that really just trying to take the chance, designing your own simulation scenario, seeing what worked, what didn't work, making those revisions along the way is super rewarding. So what do we do, and how do we get started? How do we take a group of students, like you see in this picture in the upper left-hand corner, who are in a classroom, and get them fully immersed into simulation scenarios and activities in our simulation center? And you can see a few pictures of that. And again, can be a little bit intimidating, but it's a lot of fun and very rewarding when you see the efforts that you've put into designing and developing a simulation and seeing it actually unfold in the simulation center, seeing the learners during the debriefing, having their, what I call aha moments. It is very rewarding for us. So the first step, and this is a critical step, I would say, is to pull out that healthcare simulation standard of best practice. There are multiple standards, and there's a standard that's specifically focused on simulation design. And so that's what I have here in this slide, a picture of. And if you pull out this standard, you're going to see that it serves as a framework for you, and it's going to guide you through every step of the process, all of the different things that you need to consider as you're designing and developing the simulation scenario. Again, this to me is a critical step, pulling this out right at the beginning so that you're not going back and having to do things after the fact. And I also want to point out that on this standard, something else that I believe is very critical for us to remember as we're designing and developing simulations for our learners is that, and you can maybe see it in the bottom left-hand corner, this standard starts out by saying simulation-based experiences are purposefully designed to meet identified objectives and optimize the achievement of those outcomes. And I can't emphasize this enough. In fact, I probably will say it again because it's so important. Our simulation-based experiences are purposefully designed to meet identified objectives and optimize the achievement of those expected outcomes. The reason I'm emphasizing this is because so often as the director of the Simulation Center, I see faculty who will come to me and say, oh, I want to do a simulation. And my first question to them is, what are your objectives? And it's like, oh, they don't have any objectives. They just think that it'll be cool to bring students into the simulation center, but they don't really have any goals or objectives. And that's a failure right at the beginning. Like, we really need to sit down and discuss, what are your goals? What are your objectives for your learner? Because that will drive everything else that you do in that design process. So this is a really critical element. The second part is that we design that scenario so that the students can achieve the expected outcomes. And this is sort of one of my soapbox issues, if you will, in that so often learners over the course of their lifetime, maybe they've had exposure to other simulations, they feel, or they've experienced a simulation where they felt tricked, they felt they were set up for failure, they felt that there wasn't any way they could be successful. So we need to be very intentional as we're designing our scenarios, that we have specific objectives, and that we're doing what we can as faculty designing and developing these scenarios to help our learners achieve the objectives. We are not trying to trick anybody. We're not trying to go, aha, you don't know what you're doing. This is all about a positive learning environment. It's the best place for a learner to make a mistake in the simulation setting, because there's no patient put at risk, the learner's not put at risk. And so we have to create that safe environment that allows them to have success. And so this standard is going to help us ensure that we're doing all of those things. So I know I kind of got on my soapbox here a little bit, but these are two really critical elements in that design process that need to be considered at the beginning of that decision to design and develop a simulation scenario for our learner. This slide is just highlighting for you all of the different criteria that you will find in that standard of best practice around simulation design. The very first bullet point that I have it sort of in italics, and I probably should have highlighted it in a different color, but I put it in italics because this is also something important to consider when you're designing a scenario, is that the scenario needs to be designed in consultation with content experts and simulationists knowledgeable in best practice in simulation education, pedagogy, and practice. So this is something that's also very important for us to consider. As a simulationist, as you heard, I've been involved in simulation since 2008, and I've been a nurse for almost 30 years, which is kind of frightening for me to think about in terms of, I don't feel like I'm getting older, but apparently I am. But so I have a lot of nursing experience, and my nursing background is in the medical intensive care unit. So medical critical care nurse, and I've been involved, as I said, in simulation since 2008. So those are my areas of expertise, critical care and simulation, right? But if I had a faculty come to me and say, we'd like to do a labor and delivery scenario, I do not have the content expertise in labor and delivery. And so I would need to work with content experts from labor and delivery in order to design and develop that scenario. I would not take on designing that type of scenario without working closely with the content experts. And just to give you an example, right now I have a big project at our university centered around sexual assault nurse examiners. And we are creating some simulations for the sexual assault nurse examiner program. And I am not they're called SANE nurses here in the United States. I am not a SANE nurse. I've just gone through the training myself in the last year as part of this project, but I am not a SANE nurse. And so I've involved and surrounded myself with SANE experts, nurses who've actually practiced in that field, community experts as we're designing and developing those simulations. This is important because it helps support, as you can see a later bullet point, the fidelity and the realism of that scenario. And it will help you avoid having a situation where the learner says, well, that would never happen in real life. And so you really want to make sure that you have experts around you. And I guess the other thing I want to tell you as you embark in this simulation design process, you don't have to be the expert in everything. You just need to be the expert in the simulation realm, and then surround yourself with those that have the content expertise. We're going to go through each of these other bullet points, and what I'm planning to do is kind of relate it to a project that we've done and designed. so that you can see how it relates and how I applied the standard of best practice to the design of the simulation that we did. So you do need to perform a needs assessment. We'll talk about that a little bit more. As I mentioned a few minutes ago, we need to have measurable objectives. We need to have the right modality. And what that means is, is it a task trainer? Is it a standardized patient? Is it a mannequin-based simulation? We need to develop that scenario. We need to have the fidelity or realism. We need to consider how we're going to facilitate this. And this really does depend on the level of the learner. We should have a pre-briefing plan, any pre-learning activities, the resources, experiences. We need to have our debriefing plan ahead of time and how we're going to evaluate that simulation. And then at the very end, we need to pilot test it. So you can see there's a lot of different things that we need to do as we start this process. And sometimes faculty will say to me, excuse me, well, this is a lot of work. Well, I kind of relate it to teaching in a classroom. You would never go into a class to teach any kind of content, whether it's about respiratory care or cardiac nursing, and not have objectives. You would never go into that classroom without having a plan of how you're going to engage the learners and what information you might have them read before they come in. You wouldn't go into that classroom without having an idea of how you're going to evaluate whether or not they learned that content. So it's really not any different than the other teaching that we do. It's very thoughtful and it's very intentional. So how do we reach this state of perfection? And so I'm in Michigan, and when I think of like a place that I'd love to be, perfect, idealistic place, I always think of a beach somewhere out in the Caribbean or somewhere nice and warm and sunny. So this is like how do we reach perfection here where everything is exactly as we want it? So let's go through each of these different criterions and I'll give you examples. So that first example or criterion is having your experts in simulation and your content experts. And so the scenario that I'm going to describe that a team of us developed here at the University of Michigan is an interprofessional education scenario that was a simulation-based scenario. And what we did was created an unfolding case. So it's actually 3 different simulation scenarios that were designed. The first scenario was completed by the nursing students alone. They then did a handoff to physical therapy students. Then the physical therapy students did their standalone simulation. And then all of the students came together and did an interprofessional simulation-based experience at the end. Now, one of the things that we need to consider, or we needed to consider when we were designing this, is that do we have the experts? So on our simulation team at the University of Michigan, Flint, we have myself, of course. I am, in addition to the experience I've had in simulation, I am also certified, CHEESY A certified through the Society of Simulation and Healthcare, which means I'm an advanced certified healthcare educator. I have 2 other people on my team that are CHEESY certified, and then I have 2 operational specialists that are certified operational healthcare specialist advanced as well. So we have the simulation expertise covered there. And then there is a team of us that have worked together in creating interprofessional simulations since 2015. And they include myself and 2 other nursing faculty, and then 2 physical therapy faculty. And we started developing interprofessional simulations back in 2015 when we received some grant funding from the university. And since that time, we've developed more than 20 interprofessional simulation experiences for our learners, and we've had more than 2,000 learners go through these experiences. And we've developed all different types of simulation IPE experiences. So we definitely had that expertise within our team. And we also had a lot of lived experiences in terms of what worked and what didn't work. And then within each of our specialties, each of us had content expertise in the realm of nursing or in the realm of physical therapy. The next criterion is that needs assessment. And this is also a very important. I keep saying that each part is critical, but they do really build on each other. The needs assessment is really you taking a look at the lay of the land. Is this really a need for your learners, for your program, whether you're working in the hospital, whether you're in an academic environment, even though you think it's a cool idea to run a certain scenario, is that really what's needed by the learners? And so that needs assessment helps you identify what types of scenarios you should actually be developing to address those unique and specific needs that your organization or your learners specifically have. So often I hear, another thing that I hear is people saying, oh, I want to do a CPR simulation. And I don't know why everybody's drawn to that, but are those the objectives that you're trying to achieve? Do your learners really need that? Or is that too high level for your learners? So this needs assessment is going to help you drill down, like what is exactly needed for your learners. So here on the slide, you can see what our vision was as we decided last year to redesign our simulation IPE into an unfolding simulation experience. We had this vision that we really wanted to engage the students across the 3 health science programs in active teamwork and communication behaviors. Now, as I mentioned on the previous slide, we had quite a bit of experience doing simulation IPE with our learners, and we had done the standard, bring them all together for one simulation, and then there they would practice teamwork and communication. And this is part of our needs assessment, right? We realized that one time, 1 hour, 2 hours of being in the sim center together as a team was not enough for them to actually practice those teamwork and communication behaviors that we were looking for. And that's why we had this vision of doing unfolding cases where along the way they were building and continuing to work on these teamwork and communication skills before they came to the big IPE simulation scenario. So that's part of our needs assessment, is that we as faculty felt our learners needed more. And we were also hearing this from our learners, that they wanted more opportunities to practice these skills and maybe even practice these individually as a profession, that hand off to another profession, and then practice it again in the bigger simulation scenario. So in the summer of 2021, we decided to create this unfolding case. And again, it started with nursing, seeing the patient in the hospital side, the patient being discharged to their home care setting. That's where PT came in and saw the patient. During that scenario, the patient has a change in condition. PT has to contact the provider. The patient gets readmitted to the hospital. And that is the third scenario, which is the full IPE, where all the learners come together. Now, as I'm describing this, you're probably wondering, well, how did you do all this in one day? We didn't. We did it over the course of 5 weeks. So the first 2 weeks were the nursing doing their scenario. The next 2 weeks were the physical therapy doing their scenario. And then the last part was everybody coming together for those IPE simulation. Again, our goal was to provide the learners with the opportunities to practice those skills, multiple opportunities. And then we also wanted them to get feedback on their communication strategies. And again, we felt that the way we were doing it before didn't provide them enough opportunity to get feedback. So this unfolding case idea was allowing us to have PT give feedback to nursing, the acute care nurse practitioners give feedback to PT, all before they came to the final simulation scenario at the end. We also reviewed the literature, and so I have a little bit here on the literature related to interprofessional communication, teamwork, and collaboration, and use of simulation IPE to help develop those skills. So it's important to also look to the literature to help support your needs assessment as you're designing and developing your simulation. So what do we know that's in the literature about this topic, and maybe what's lacking as we go to create that simulation scenario. And then, of course, there's also accreditation standards. So there are many healthcare professions that now require exposure to interprofessional teamwork and communication and core competencies before our learners get out into the practice environment. And ultimately, as faculty, we understand, and even if you're working in the hospital side, you understand that future healthcare workers have to be ready to collaborate and interprofessionally as soon as they graduate and as soon as they're out in the practice environment. So it makes sense that we would be providing them those opportunities to learn about these critical skills before they actually graduate and are entering the practice world. Of course, I also included here as part of my needs assessment. So now I know that we have a true need at our site to do some additional work related to interprofessional collaboration competencies. And I think I've described how we came to that conclusion. This is also the point too, where I'm going to go back and look at those standards of best practice. So I have the standards of best practice simulation design shown here, but I also have the standard for the Association of Standardized Patient Educators, that standard as well. And the reason I have that standard is based on the fact that the way we were going to create the scenario for our learners to have multiple opportunities for teamwork and communication, and we were also using physical therapy students in order to engage our students across all three of those simulation scenarios. We recognized that the best way to do that would be to use a standardized patient as opposed to a mannequin. And so right away, I want to pull those standards related to using a standardized patient to make sure that I'm following the standards of best practice as I design the standardized patient portion of that scenario. The other thing is as I mentioned too, this was a interprofessional simulation or sim IPE. And there is also a standard of best practice related to simulation enhanced interprofessional education. And so you pull all three of these standards and you're going to see a lot of overlapping information in them. It's not meant to be overwhelming. There's a lot of good information and important things for you to consider as you're designing and developing a scenario. The four key criteria for the IPE simulations are that you're using a theoretical or conceptual framework. You're using the best practices in design, which we are. We're using the ASPE standards. We're using the NACSL standards. We also need to recognize and address any potential barriers to sim IPE. And then we also need to have an appropriate evaluation plan. And if you're looking at the simulation design standard, many of those things are already included in that standard as well. So criterion 3 is looking for us to construct measurable objectives. And when I started this presentation, I said this is a critical element, and it really is a critical element because your objectives are going to drive the design and development of your simulation. For the scenario that I'm discussing that we developed last fall, we focused our objectives on the IPEC or the Interprofessional Education Collaborative core competencies for collaborative healthcare practice. And we specifically focused on, there's 4 core competencies, which you can see on this slide, competencies 3 and 4. So we focused on objectives related to interprofessional communication, and then objective 4, teams and teamwork. And the key thing here too is because it's interprofessional, notice that our objectives did not focus on nursing conducting an assessment appropriately or PT, assisting the patient with the walker. They were interprofessional related competencies that were our ultimate objectives for that end scenario that we created. The scenarios leading up to that final sim IPE did have some specific objectives related to each profession, and I'll talk about those in a minute too. But all of them built to our ultimate objective of that interprofessional communication and teamwork. We also used a theoretical model, and this is criterion 4. So after you've developed your objectives, again, these objectives are going to help design or lay that foundation for your design of your scenario. from there, that helps you determine what modality you should use. So for example, I said our objectives focused on communication. So as I'm thinking about what modality to use for my scenario, if I wanted to focus on communication across professions or even communication with a patient, for example, what is the best way to do that? Can I do that with a mannequin? Well, you can do it with a mannequin, but is it better to be done with a standardized patient where you have that emotional context and interaction? And sometimes learners are better able to interact with a standardized patient if you're really focusing on communication, emotions, empathy, compassion, than they are with a mannequin. So those objectives help you determine the modality. If your objective was to observe them doing sterile technique properly when inserting a Foley catheter, well, then maybe you just need a task trainer for that simulation-based experience instead of a full-on mannequin and fully immersive simulation experience. So again, those objectives really help us determine what we need and how much we need. You know, sometimes we get all caught up in the bells and the whistles. Like there's so much cool technology we can use, but you don't necessarily need to use all of the bells and whistles, depending on what your objectives are. You can do simulations in your classroom, and so you don't really need to have the whole sim center to run some very, what I call low fidelity simulation scenarios. And again, those are all driven by your objectives. So you want to build your simulation-based experience to align the modality with the objectives. So ours was focused on, again, communication and teamwork. We also knew that we had nursing, physical therapy, and acute care nurse practitioners that would be participating in this scenario. And in order to engage all the learners, when you think about physical therapy, well, they work very closely with helping patients with their mobility. So it's difficult to mobilize a mannequin. And so again, that was another driving factor in us deciding to use a standardized patient as we were designing that scenario. You can see on the slide here a couple of theoretical models. We tend to use these two theoretical models, Kolb's experiential learning as an adult learning theory, which is really a nice model to use in the simulation realm because you have an experience, then you allow the students an opportunity to reflect. They get some opportunity for abstract conceptualization, and then they have active experimentation and then an additional experience. And then we also use Erickson's model of deliberate practice, where they have repeated intentional exposure with feedback, guided feedback from experts. And so, as I was mentioning, they had multiple opportunities to practice these teamwork and communication skills. And so that's one way that we were applying Erickson's model of deliberate practice. This slide is just showing you some of the ways that you can align your modality with your objectives. So just thinking about the different modalities that you have available to you when you're creating a simulation-based experience, standardized patient, but there's also virtual. There's mixed reality now today, mannequin-based, procedural-based, task trainer. And again, all of these are going to be based on your objectives in terms of which one will best suit your needs for that scenario. And then as you're designing, remember that we want all scenarios to have a starting point, and we also want them to have structured activities during that scenario and then an end point. So in this IPE simulation, we had 3 scenarios that we were designing. So I'm going to talk about the nursing one first. And so our starting point was, okay, we need to have a patient situation where the nurses are interacting with that patient and need to provide a handoff to physical therapy. So we decided, okay, let's have the patient be in the hospital, elderly patient with pneumonia. Maybe they have some frailty issues, some cognitive decline, and they're being discharged home. They need a walker. They're going to need PT to see them at home. So the nursing scenario really focused on the nursing students providing the patient with discharge instructions, doing a mini cog, and then giving a handoff report, a recorded handoff report to physical therapy. So those were the structured activities within that individual scenario. The scenario's ending point was the nurses completing that discharge instruction and then recording their SBAR handoff report. And then PT did their scenario. Their scenario started with the patient being now in the home care setting. PT was to do an initial evaluation of the patient in the home care setting. And then as they were doing that, the patient would have a declining condition. PT was supposed to recognize that and then notify the acute care nurse practitioner. And then the final scenario starting point was the patient now being in the hospital side of things, continuing to have some issues that required intervention by the entire team. And then the nurse practitioner coming in and providing directions and orders. So there's your starting point, some specific activities, and then an ending point for all three of those scenarios. And I'm not sure if you guys can hear this or not, but one of my dogs is sleeping here and snoring by me. So I apologize if you can hear any kind of rumbling in the background. It's my dog snoring. So at this point, you might be feeling like this is a lot. And it's a lot of work. It definitely is a lot of work, but you can get through it. And sometimes it's overwhelming. And this is where too, having a team or even working with somebody else as you're designing a simulation scenario can be very, very helpful to you. So criterion 5 is now where we're really getting to the meat of it. And this is the part that I think everybody wants to jump into is designing that scenario. You got this great backstory and you just want to do that, but you have to really consider all of these things that I've talked about before you get to this part, or what I consider to be actually the fun part. So when you're designing that scenario, you really want to have that backstory that's about the patient. So, tell us about this patient or think about that patient. So here you can see our patient's name was Lewis Gardner. And we make our patients gender neutral or try to with their names because we never know what standardized patient we're going to have if it's male or female. And this allows us flexibility. So just a tip to consider. So you can see the gender we have listed there, male, female, and we give an approximate age. We identified what religion they are. We've created what past medical history that patient has, history of present illness, and then social history. And I want to point out too that you can see on the right-hand side of this screen a design template that I use. And this template actually comes from the National League of Nursing. There are multiple simulation design templates that you could find out there. I tend to like the National League for Nursing one because it really, page 1, you can see it walks you through describing the patient. So even if you didn't know, you would see, like I have it all filled in, but they'll have a blank area for past medical history, a blank area for present illness. So it's walking you through all the things that you want to include in that description of the client. It's multiple pages too. It also walks you through selecting the modality. It gives you an area for the SBAR report that you would create that you'll give to your learners. And there's an area for the debriefing and facilitation. So it really does a nice job kind of following the standards of best practice simulation design. And it helps you organize all of that information. You can also see on the very top part that it says student level. This is also really important to consider, and how much reflection time, where that's going to happen, the location of the scenario. So this first scenario, again, the location was the hospital setting. It was the nursing students. It was an elderly gentleman admitted with pneumonia. And you can see that we gave him enough medical history that it would make sense he was there, COPD, congestive heart failure, MI, and that he also had a diagnosis of pneumonia 3 days prior. And then you got a little bit of social background as well there. So this is really kind of getting into that component of what is this patient scenario and how is this going to all unfold. Part of this design process too is creating what's called a progression outline. And again, I'm using that template. This is right in that NLN template to help me as I do this. And what you need to do is literally break it down. First 0 to 5 minutes. What will the mannequin or standardized patient do? What do I expect the learners to do? And then I also need to consider, and this is important, what would happen if the learners don't do what I expect, which, we always want them to do what we expect them to do. But I'll tell you, in all these years of doing simulation, you will be surprised at some of the things that will happen or not happen during the scenario. So you really want to spend some time thinking about what do you expect them to do? And then that last column is cues. What will you do if they don't do that to get them back on track, to help them achieve your outcomes and goals? Remember, we're trying to make sure that they can accomplish our goals and objectives. So you've got to really think through every piece of this. What will the patient say? What will the vitals be? How will those change? How will you get the patient back on track now, or not the patient, the learners back on track if they're not meeting those expected interventions? And you can see most of our scenarios are about 15 minutes, no more than 15 to 20 minutes at the most. That's more than enough time for them to achieve the objectives that we're looking for without them feeling like they're just lost and getting stuck. And the cues, you can see, we used the family member to provide some cues, but sometimes the cue could be a doctor calling in. It could be a charge nurse coming into the room. And again, this is really the point where you want to be thoughtful about what way can you give the learner a cue without disrupting the fidelity of that scenario, but helping them stay on track and keeping that realism within that scenario. Every aspect needs to be considered. You can see lung sounds are listed here. Are they normal? Do they have crackles? Does he have a cough? Is it productive? And you also have to think about what questions, especially with a standardized patient, but this is true with the mannequin, the learner might ask the patient and then how the patient should respond. And sometimes you may have to do things on the fly, but we really want to have everything scripted out tightly, because the last thing you want is for the standardized patient or for whoever the sim tech is to just go off and start saying different things that will lead the learner down what we call rabbit holes, a totally different direction than where you want the scenario to go. So that's why you want to spend a lot of time on that process of identifying what's going to happen in 0 to 5 minutes, the next 5 minutes, what will happen, the next 5 minutes, what will happen, and then ensuring that you have enough cues and things to drive that learner into the direction that you want them to. In this area too, you do want to think about or start thinking about what information you're going to provide the learner to help them be successful. So you can see for all of my simulation scenarios, we create what I call like a welcome letter that gets posted in our learning management system. And so this welcome letter tells them how to prepare. And this simulation was actually embedded in a full 8-hour day of experiences where they also did skills. So you can see what we gave them in terms of preparing for the skill part of the day, and then also how to prepare for that simulation experience as well. We also tell them what to wear, to bring their stethoscopes, and what other information they may need to have in order to be successful during that simulation scenario. Fidelity. So the slide really, the only thing that changed on the slide was the term fidelity at the top. So fidelity talks about the realism that you're going to create in that scenario. So how will you make this seem like a real experience? So again, we were going to have our nursing students interacting with a patient who's going to be discharged home from the hospital. So fidelity means that the best place for that scenario to take place would be in a simulation area that looks like a hospital setting. So things that we would want to include in there to make it look more like a hospital would be a patient bed, oxygen, because the patient had COPD and pneumonia, maybe an IV pump, monitors, a walker for the patient because he was being discharged home with physical therapy. So these are some of the things that I would consider for fidelity to help increase that realism. Once the patient was seen by the nursing students and the nursing students did their handoff report and recorded that, then PT had their individual simulation experience. Now, at that point in this unfolding case, PT was seeing the patient in the home care environment. So we did not run that simulation in our hospital setting room. Instead, we ran that simulation in our, what we call our home care environment, which looks like a home. It has a couch, it has a chair, it has rugs, it has all kinds of things that look like a home setting. So again, that's helping create the fidelity. There's no monitors, there's a portable oxygen, because this is what a patient would have at home. We had the walker available. We had all the patient's medications and pill bottles, because PT needed to go through and do a med rec as part of their initial PT evaluation in the home care setting for the patient. So those are some examples of how to consider fidelity. And then the final scenario, the patient was admitted back to the hospital. So we were back into that hospital room. And because we wanted it to be like an actual unit in the hospital, we had multiple patients there in that simulation area during that time. So there were multiple patients, there were call lights going off, there was a charge nurse, lots of activity to make it seem like an actual unit. And the students were assigned, the nursing students were assigned more than one patient, because again, that created additional fidelity. Nurses don't only have one patient, they have multiple patients. And so that was our layering of fidelity in that final simulation. That was the IPE focused one. I want to show you a few other things that we did related to fidelity. So we did do IPE handoffs between the learners. So nursing did an IPE handoff to physical therapy. And then physical therapy did one to the acute care nurse practitioner, all before they came to that final simulation scenario. We used a product called Flipgrid. This is free. It's called Flip now. They changed the name, but basically it's an online platform where the learner can actually record their report. And so you can see here on this slide, you can see all the students created their video report. And on that previous slide here, you can see these QR codes. Whoops. And the QR code is actually what we sent to PT. The PT student scanned the QR code, and then they were able to see the individual giving report. And for sake of time, I'm not going to play the report, but you can see one of the students here giving their report. We told them it could be no longer than 3 minutes. And so there was a video recording of them giving the report to physical therapy. And then physical therapy provided the nursing students with feedback. And I'll show you the rubric that they used in a minute. This is, again, so after nursing gave their report to PT, PT listened to it. They came in and saw the patient in their own individual simulation with in the home care setting, as I was describing a minute ago. The patient had a change in condition during that scenario. And then PT needed to do their report to the acute care nurse practitioner. And then here's a picture of the PT students, and it was pairs of 2 PT students giving their recorded handoff report to the acute care nurse practitioner. And the acute care nurse practitioner then gave feedback to the PT students. This is all part of that theoretical model of deliberate practice. So our learners having multiple opportunities to practice and also get feedback, not just from faculty, but from other interprofessional team members. And that was something that was really important to us because we felt that wasn't happening before. The final scenario, excuse me, was again, them all coming back to the acute care setting. Patients been readmitted, so the entire team, and we kept the teams together, met together and were taking care of the patient in the acute care setting. This slide is just showing you a recording of the report that I gave to them, the nurses, as they started that scenario. And the one thing I will say about that is, you will create a report for your simulation scenario that will start that scenario for your learners. Because you're often doing this multiple times with multiple groups of learners, sometimes what happens to me is that, you know, the 5th or 6th time I'm facilitating this scenario, it's like, did I say this the same thing, the same way? Did I give the same report each time? Also, if you have multiple facilitators, did Denise, my colleague, do it the same way that I did? Did she follow the script or did she ad lib? So one thing that we've done with our reports to make sure that they're consistent, the same report. And exactly what we want our learners to do is record our report. So then we don't have to repeat it multiple times. If we have multiple facilitators, we know that all of the learners are getting the same report. So that's just a little tip. And that's what you see here is the me giving a recorded report. And when we ran this, the SIM-IPE, we had 250 learners coming through that. So that was like 40 or 50 teams that we would have had to give report to. And that's why the recording of the report is very helpful there. And then here we have the actual patient encounter, and you can see the actual encounter with physical therapy and the patient having the change in condition, where they'll actually call in the nurse practitioner and the entire team will be involved in the care of the patient at that point and practicing those interprofessional communications and teamwork. The next criterion that we need to consider as we're designing and developing a simulation is the facilitative approach. And what this means is you as a facilitator, how involved are you going to be in this scenario? So the key thing to think about, or I always think about with facilitative approach, is what's the level of my learner? If it's a brand new nursing student who's never been involved in a simulation before, your facilitative approach might have you as the facilitator being in the room, kind of coaching the learner through, or maybe standing off in the side and then doing timeout, let's stop and talk and rethink about this. So let's start again. So that's a very kind of like you're holding their hand a little more as they're getting used to being in a simulation experience. They're very nervous and maybe they need a little more guidance at that point. If your learner is further along in the program, your facilitative approach may be that you're going to stand back, let whatever happens, and then you'll talk about it during the debriefing. So you want to know how much facilitation you will be providing the learner before you actually run that scenario. This needs to be decided ahead of time. And then if you are doing the standing back piece, you need to know what cues you are willing to provide the learner to get them, like I said earlier, back on track so they're not going down into a rabbit hole. Again, this really needs to be thought about before, and it's really critical if you have multiple facilitators because you all want to be on the same page in terms of we're not going to go in and rescue them. We're not going to go in and tell them what they need to do, but we're going to give them these cues. Or we are going to be more hands-on and give them more guidance because they're newer learners. So facilitative approach is something else that needs to be considered. Along with that is your pre-briefing plan. What information will you give the learner before they actually start the simulation scenario? And remember at the very beginning, I said, we want them to be successful, right? So this pre-briefing plan is also creating an environment that is safe, psychologically safe, that it's okay for them to make mistakes. It's okay for them to experiment. And that we are all here learning together. We use something called positive intent framework, and that means that we're all going to assume the very best of each other, and we're all here to learn to, or with and from each other, and we're going to assume the very best. That if Carmen made a mistake, it's not because she wasn't trying, it's because she's doing her very best today, and how can we support her? So that's part of our pre-briefing and setting that safe framework for the learners to be themselves and make the decisions that they think are best during that time. If they're the wrong decision or maybe not best for the patient, we'll talk about it during the debriefing, but we're not going to judge each other during that. We also want to consider what pre-learning activities the learner may need to help them be successful. We use a learning management system. This one's called Blackboard. We're moving to Canvas this fall, but we post this information on our learning management system. And here you can see some examples of those. So we have some videos. There's different ways you can do this. We do videos that they can watch, and you can see they're like a minute long, 2 minutes long. We may assign some readings for them. You can be creative in how you give them material to review so that they can be successful. And then you can see too on this slide that we created, just like the report, same idea. We created our own pre-briefing model module that the learners would listen to that goes through that positive intent, goes through the pre-briefing. And it's a very generic pre-briefing, and then we can add any specific information we need to related to that scenario at the end of that. We use this across all of our simulations, that pre-briefing module, because again, it allows us to be consistent in providing that same information and creating that psychologically safe environment for all of our learners. The other thing we need to think about is our debriefing plan. And there's a whole nother standard related to debriefing plans, but you want to have this plan established ahead of time. And for this IPE program, there are different evidence-based debriefing models. So you do want to use one of those. And I would encourage you to look at that standard. We use the PEARLS method. It's something we've had great success with, and our faculty facilitators are very comfortable with. But the other thing that we did, and you can see we create a lot of tools and guides. We created a guide because we had multiple facilitators. So we created a debriefing guide based on the PEARLS method to help make sure that all of us who are debriefing different groups were covering the same things during our debriefing, because that is actually where the learning takes place. So all of that was decided ahead of time. And then the other thing was the identification of evaluation metrics. So one of the things that we did was have our learners evaluate each other's handoff report. And here's an example of that rubric that we used for our learners. So this was one of our evaluation metrics that we used. And then the faculty, we watched all of the videos from the learners. I'm showing on this slide, there are multiple different ways that you can evaluate your simulation scenario and the design of it. There are several standardized tools available. You can find these on the Anaxo website. And I would encourage you that if you're evaluating a scenario, use those tools that have already been established, that are well established, vetted and tested with high reliability. As you're, don't create your own tool, I guess is what I'm saying, because there's multiple tools out there, like Creighton tool, there's the National League Simulation Design tool, there's a self-confidence and self-efficacy, there's the that tool, and a lot of these tools are free for you to use. You just have to ask permission from the authors. And again, a great place to find these tools are the National League for Nursing and the Anaxo website. You can find these tools. You could also do a video assessment. That's a little more complicated, but you could watch videos and score the learners. You could use a reflection activity, so having the learner reflect on that experience. You could do worksheets, or you could even do testing with your learner. And when we talk about testing, that's the last bullet point on this slide, is that you could decide that the simulation experience is going to be a formative type of experience where they're getting feedback, and then they're going to ultimately do a high stakes simulation where it's a pass-fail type situation. I'm a big fan of, if you are going to do a high stakes simulation, they need to have multiple opportunities to have practiced and have that formative feedback along the way. Again, our goal is that they're successful. You would never want to put somebody in a high stakes simulation scenario without first knowing what they're being graded on, or, you know, pass fail on. And you would never want to just put them in that without them having the opportunity to practice what you're expecting them to do in that high stakes scenario. Here's just an example of an IPE simulation tool that we've used in the past. And again, there's multiple tools available. And then as we wind down, the last piece is pilot testing. And so I have this little, I love dogs, and I have 3 dogs that are all labs, and the dog has the towel on his head, like he doesn't want to think about it. But so you've done all this work, right? And months of developing like these 3 scenarios. Now we have to pilot test it. And so one thing I will tell you, when you're designing your simulation scenario, and I probably should have said this earlier, is I think of backwards design. We wanted that last simulation to happen in October. So we worked backwards from October, like, okay, when did PT need to see the patient? Okay, they needed to see the patient. So we were going to do that final sim October 15th. We needed PT to be done with their home scenario by October 1st. Okay, well, nursing had to do their scenario before PT. So we needed nursing to do their scenario by September 15th. And then, okay, if we were going to pilot test this scenario after we designed it, we needed to have it developed by August at the latest, so that we had time to pilot it and make whatever changes we might need to get that scenario where we wanted it. So really, we needed to have our scenario done. We had it done by the end of July. That gave us the month of August to pilot test it with a group of similar students. Now, the group doesn't have to be big, but you really want this feedback, and you want the opportunity to see, is your scenario helping the learners meet the objectives? And you want the learners to give you that feedback of, yes, this was what we expected, or we didn't expect this. This was not clear to us. We needed more information in the patient chart. We didn't understand this, or this worked really well. And that allows you the opportunity to make those changes. We require pilot testing for any new scenarios that are run in our simulation center. And it is so very important. I know a lot of faculty would prefer to just run the scenario, but you learn a lot. So don't forget to build in this component, because it really allows you to make sure that you've set the learners up for success and that your scenario is meeting the objectives. And I can tell you, when we first started doing our IPE scenarios, our first pilot test, we thought we had this great simulation scenario, and then we realized that one entire group of learners wasn't actually engaged in the scenario at all because of the way we had designed it. If we hadn't done the pilot testing, we wouldn't have been able to make that shift ahead of time. And that concludes my presentation. I think I'm just a minute or so over, and I'm not sure if there's time for questions, but I want to thank you for inviting me to be here today. And I hope that hopefully you were able to take away one or two things from my presentation.
Great. Thank you so much for that, Dr. Turkelson. I know we could talk about this all day long. There's so much to it, but there is one quick question while you still have your slides handy. Someone from the University of Botswana had asked if you could share again the screen for exemplar criterion 5.
Yes. Yep.
And then we can have time for maybe just one more question if there are other questions from the audience.
And I can share my slides too. I meant to send them to you guys, but like I said, I was sick last week with COVID, so got kind of derailed. So I had a couple slides on the design on criterion 5. So here's one of those slides.
And we did put a link to that NLN design template in the chat, so that template is available.
Yeah, it's a great template. It's just one of many that are out there, and it just happens to be the one that I do like to use because it really is pretty comprehensive, and it fairly closely follows the standards of best practice. So it will help guide you through. And if you do choose to look at even the ACEs unfolding cases, the NLN cases that are available, you'll see they all follow this template. They have charts. It's really a nice place to start as a new simulationist, or if getting your feet wet to see what all you need to have developed. It's one of the first places I started.
Great. And I did see a hand. Oh, I saw a hand somewhere. You gave like Dr. Ocho, if you had a question.
Yes. Thanks a lot, Carmen. This was really a very clear presentation.
Thank you.
Caused me to think a lot, but as I look at your criterion 5, is it that we must develop the scenario by being very clear at every step for the period of time? There must be cues that the simulationist must be looking for, and it is documented. Does the client or the person who is acting, do they need to have that as well?
Yes. So if you're using a standardized patient, there's a whole separate guide that we developed for our standardized patient that gives the standardized patient or actor all of the backstory and how they should answer and respond, and when timing of when they should say certain things. And then, like I said, we try to identify any questions that the learners might ask that standardized patient. And this is true even with a mannequin too. You want to have thought about this. Like, what if they ask about allergies and we didn't address that? Well, how would they respond? And so, like, for the patient that the scenario I was describing, the patient was having some signs of dementia. So it probably would have been okay if he said he didn't know, or he said something that was different than what's in the chart, because we could say, well, he's confused, or I have dementia. Like if they said, oh, it says here you have an allergy to codeine, and the patient said no. The last thing that you want, though, is for them to go down the wrong, like I said, that rabbit hole that takes them in a whole nother direction. So you really do want to think, what should the patient be saying at each different point? What will their vital signs be? What do their lungs sound like, heart sound like? And then what cues will you provide them? If they don't accomplish what you expected them to at each point in that scenario, what cues will you provide them? Sometimes we've done things like in that scenario where they weren't getting to the discharge planning piece of it. They were spending a lot of time wrapped up in the chart. We had the family call in and say, I'm on my way to the hospital. Have you given the patient discharge instructions? So those are things that we think about. Like if this isn't being accomplished in that 5 minutes or by the 15-minute mark, they still needed to do discharge planning. That's how we could get them back on track. But you want to have thought about that before you're actually in the moment and you're at 15 minutes into the scenario and they haven't done discharge planning. And that was one of the critical things they needed to do before the scenario stopped.
Thank you so much. I think this is calling for a whole workshop on developing scenarios.
Yes, it definitely is very involved. And as I was putting together the presentation, I'm like, oh my goodness, I only have an hour, and I could probably talk for a couple hours on how you do a simulation design. Yeah.
Certainly. All right. Thanks so much again, Dr. Turkelson. For the sake of time, I will excuse us to break. We'll take about a 15-minute break here. There is one more quick question in the chat, if you don't mind, maybe just giving that a quick answer for us.
So which evaluation tool you use, and my students hate this answer, it depends, right? So it depends on what your goals and your objectives are and for the simulation scenario. For example, if you want to, right now we're pilot testing some simulations with on a project that we're doing with Ann Arbor, and we want some feedback on the simulation design. So we're actually using the NLN simulation design survey tool to get that feedback on the design, how we design that simulation scenario. You could look at usability of, if you're using a virtual or mixed reality. If you're looking at communication and teamwork, like we used the Indian IUISR, and that was looking specifically at teamwork and communication behaviors. So I know you hate that answer, it depends, but I did see in the chat that it looks like Dr. Abersol gave a link to the evaluation tools, and you can see some of the different tools that are out there that could help you achieve your goals for evaluation.
Great. Thanks again.